Certificate of Need laws, why they exist and who they hurt. Originally designed to improve access to healthcare for American families, Certificate of Need laws are now restricting much needed healthcare capacity, hurting those they were intended to help. Northport, Florida is a coastal town on the western side of the state. It has a population of around 60,000 people, 26 parks, 10 schools and no hospital. Travel 30 miles north and you hit Sarasota, Florida. A city with a smaller population has 2 hospitals. In 2003, Northport rallied support among city residents for building a hospital. The city was continuing to grow, and residents needed a healthcare facility nearby. The city gathered 20,000 letters of support for a hospital and applied for a Certificate of Need, CON, state policy that requires cities to get approval from a state regulatory board before building new healthcare facilities. Florida initially approved Northport's CON, but surrounding hospitals appealed the decision and won. The community was left without a healthcare facility it wants and needs. Unless you work in policy, you've probably never heard of Certificate of Need laws. However, like the people of Northport, these obscure laws have a significant impact on American lives and patient access across the country. But what exactly are Certificate of Need laws, why were they put in place, and who do they hurt? What are Certificate of Need laws? Certificate of Need laws are regulations that require healthcare providers to get special permission from the government before adding or expanding healthcare services or facilities. For example, if a hospital wants to add an infant heart center, it has to first prove to the state regulatory board why that center is needed, hence the name, Certificate of Need, also known as CON. Here's another example: if a town or city wants to add a hospital, like Northport, Florida, it has to go through the same petitioning process. The steps for applying for a CON can take years and cost hundreds of thousands of dollars. Notably, existing hospitals and healthcare providers have the power to oppose the CON of a would-be competitor, by simply claiming there is no need for additional medical services. The Mercatus Center at George Mason University notes, this is akin to McDonald's needing permission from Burger King to open a restaurant. Why were Certificate of Need laws created? In 1974, the federal government passed the National Health Planning and Resources Development Act. The legislation withheld funds from states who did not enact Certificate of Need programs. By the early 1980s, every state except Louisiana had enacted a version of CON laws. These laws were originally put in place to control healthcare costs, increase healthcare quality, and improve access to care for low-income families. But research shows CON laws have failed to achieve their stated goals, and have actually done the opposite of what they were intended to do. The federal government noticed these laws weren't meeting their intended goals and repealed the CON mandate in 1986. Several states followed suit. Who do Certificate of Need laws help? Existing hospitals, doctors, and other medical providers benefit from CON laws. These laws shield these groups from competition. Who do Certificate of Need laws harm? Certificate of Need laws harm patients and taxpayers, who face higher healthcare costs and fewer options. The Kaiser Family Foundation found states with CON laws had 11% higher healthcare costs than states without those laws. A study by the Mercatus Center at George Mason University found the presence of a CON program is associated with 30% fewer hospitals per 100,000 residents across the entire state. Another Mercatus Center study found CON programs have about 99 fewer hospital beds per 100,000 people than states without these regulations. CON states also have fewer ambulatory surgical centers than non-CON states. In addition, CON laws particularly harm people who live in rural areas. Research shows there is no evidence CON laws increase access to care, and may be limiting access for rural residents. What states have Certificate of Need laws? 35 states have Certificate of Need laws on the books. What states removed Certificate of Need laws during the pandemic? 24 states suspended CON laws during the pandemic. Florida is the most recent state to do so, and after they did, more hospitals started popping up all over the state. Because these laws were suspended to help hospitals and doctors respond to the coronavirus, many questioned why these laws were necessary in the first place. Fast facts about CON laws. 35 states have Certificate of Need laws. 24 states repealed Certificate of Need laws during the coronavirus. Certificate of Need laws harm patients by reducing healthcare quality and reducing access to care. States with con laws have 11% higher healthcare costs than states without con laws.